Just have something intriguing about it. Oh, yes. Oh, yes. Yes. Yes.
That's my hometown.
It goes.
That is nice.
Oh, yes.
My brother was born in Tricor, but his father was in the government service, so he has moved around.
രണ്ട് ഫോട്ടോ ഒരു സമയത്ത് വീണ്ടും മലയാളം.
No.
This is the special photographer. He took 2 photos at the same time using 2 cameras.
Champion.
Using 2 different cameras. Specially skills. See? ഒരു പിടിയില്ല വീഡിയോ ലൈവിൽ പോകണം. ആ ആയിക്കോണ. Sorry.
Good evening, everyone. May we please request everyone to settle down with the seats here? Thank you. I would like to acknowledge the dignitaries present here today. Her Honor, the Honorable Vicky O'Halloran, Administrator of the Northern Territory, and Mr. Craig O'Halloran, Honorable Ngari Akit, Speaker of the NT Legislative Assembly, Mr. Mark Turner, Professor Daniel Bressington. On behalf of the Mental Health Foundation Australia and our chairperson, Mr. Vasan Srinivasan, I would like to welcome and thank each and every one of you for attending our launch of the National Mental Health Month 2021 here in the Northern Territory. National Mental Health Month is an initiative of the Mental Health Foundation Australia, or MHFA, to advocate for and raise awareness of Australian mental health as a community. The MHFA's National Mental Health Month is unlike many other mental health awareness campaigns. It aims to bring all Australians together in a nationwide conversation about mental health, and we aim to maintain this conversation for an entire month and beyond through a series of various mental health-related events. National Mental Health Month is a program that the MHFA is extremely proud of. and we intend to reach out to and educate as many Australians as possible to help reduce stigma and facilitate positive and non-judgmental discussions surrounding the important topic of mental health in Australia. With 1 in 5 Australians experiencing a mental health illness, it is time we give mental health its due attention. And that is exactly what the MHFA is wanting to achieve. Throughout this month, many events have been organized in each state and territory of Australia, aiming to attract and unite Australians of all ages and backgrounds to raise awareness of the need for better mental health for all. This year, the theme of National Mental Health Month is Post-Pandemic Recovery Challenges and Resilience. This year's theme will focus on raising awareness about mental health in various industries and communities. Every individual has faced, and many are still facing, unprecedented challenges due to the COVID-19 pandemic. With this theme in mind, we aim to extend our campaign even wider than previous years, with events planned to embrace many different community groups and people of all ages walking on the road to recovery and fostering resilience. #Resilience and Recovery. Please join us in celebrating the Mental Health Foundation Australia by viewing a short video. Video, please.
Hi everyone, I'm Vasan Srinivasan, Chairperson of the Mental Health Foundation Australia. It's a privilege to lead this wonderful community-based mental health organisation in its 91st year of establishment. The MHFA has grown strength to strength over the past few years. With Victorian Mental Health Month in 2018, the National Mental Health Month occurring in 2019, 2020 and this year in 2021. Last year, COVID-19 did not stop us from achieving our National Mental Health Month campaign. I'm proud to say we successfully shifted many events to a virtual platform, very much being able to pursue our objectives of raising awareness and advocating for better Australian mental health. Our primary aim is to reach out to and educate as many Australians as possible, to help reduce stigma and to encourage constructive and non-judgmental dialogue on Australia's critical mental health issue. The highlight of last year's campaign was reaching out to 100,000 Australians all across the country for our national walks for mental health, both virtually through our MHFA app and physically in some states. What a grand success that was. In 2021, with pandemic still affecting many of us, we decided not to give up once again, curating a carefully chosen blend of virtual and physical events for Australians to participate in. This year, we have a new and improved MHFA app, giving people the opportunity to participate in National Mental Health Month from the palms of their hands. This year, theme is mental health and post-pandemic recovery challenges and resilience. Mental Health Foundation Australia is proud to partner with Australian technology business DB Results and take up the well-being app Am I OK? to support our members, enabling individuals to regularly check in on a private and secure platform and ask the question, am I okay? Am I okay also alerts the user when it's time to seek outside help. We thank DB Results for this opportunity to promote well-being and early intervention. This year, we have launched a special initiative, the Mental Health Appeal on the 10th of October, our World Mental Health Day. Through this, we aim to raise funds for the development of a course promoting life and safety in young people. At the MHFA, we pride ourselves in making sure all of our programs are for the community and powered by the community. We have a vast growing network of multicultural ambassadors, youth ambassadors, and future leaders who further the community voice in promoting mental health and well-being. Our multicultural network has inspired our educational and multicultural webinars as an initiative to assist individuals cope with success during the pandemic. I would like to take this moment to thank our board of directors support staff, multicultural and youth ambassadors, future leaders, MHFA members and major sponsors for their continuous support of our organisation as we continue to work to deepen understanding of the importance of mental well-being and educating the community. Let's work in solidarity for the benefit of our mental health. Thank you, Australia.
Thank you for that. Before we proceed to the program, I would also like to acknowledge the Larrakia people, the traditional owners of the land that we live, work, and meet on today. We would like to pay our respects to their elders, past and present, and emerging. And also I'd like to acknowledge, he's just arrived in the room, Mr. Luke Gosling, our MP, a federal member of Solomon. Welcome, sir. Now to move on, I would like to now invite our chairperson of the Mental Health Foundation Australia to welcome you all, Mr. Vasant Srinivasan. Mr. Vasant Srinivasan is currently the chairperson of the Mental Health Foundation Australia. He has pioneered many new ventures in the MHFA, such as National Mental Health Month, and he strongly believes in the power of community and supporting community. Vasant has been involved in the community in a voluntary position for many years before being appointed as Vice Chairperson and now Chairperson of the Mental Health Foundation Australia. Vasant is also the first Indian to be appointed in the Australian Multicultural Council and is also the chair of the Confederation of Indian Associations of Australia, as well as patron of the Australia-India Business Council. Please join me in welcoming Mr. Vasant Srinivasan.
Good evening. I would like to pay my respect to the traditional owners of the lands on which we meet today, and I pay my respects to the elders, past, present, and emerging. I also extend the same respect to any Aboriginal or Torres Strait Islander peoples here with us this evening. I would like to welcome and thank everyone who has taken the time to join us this evening. It's a very special event, where we launch our National Mental Health Month awareness campaign for 2021 in the Northern Territory. I would like to take this opportunity to welcome all of our special guests who are here with us this evening. The Honourable Vicky O'Halloran, the Administrator of the Northern Territory, and Mr. O'Halloran, Madam Speaker, Honourable Mary Arkish, Mr. Luke Gosling, Professor Daniel Bressington, Mr. Kevin McCoy, and Ms. Camilla Scafetti. I would also like to congratulate the Northern Territory Mental Health Coalition for their work as a big body in the Northern Territory. Like this launch, there is a launch happening in each state and territory of Australia, whether that be virtually or physically. These last 2 years have been unlike anything anyone could have imagined, with COVID-19 bringing many new norms, such as social distancing, work from home, quarantine, and so on. The Mental Health Foundation Australia has made sure the pandemic situation does not compromise our National Mental Health Awareness campaign. We have organised various virtual and physical events on many different aspects related to mental health. This year, our theme for National Mental Health Month is Post-Pandemic Recovery Challenges and Resilience. And what a relevant theme this is, considering the impact the pandemic has had and is continuing to have on our Australians. In the Northern Territory, this year our planned events include our Multicultural and Refugees Mental Health Symposium on the 4th of October, and our Walk for Mental Health on the 17th of October. I encourage you to participate in these events and join us in our mission of advocating for and raising awareness of mental health. To facilitate the task of running all these different events, in 2018, the Foundation implemented our Australian Multicultural Ambassadors and Australian Youth Ambassadors programs, comprising of a dedicated network of volunteers across the country, with the aim to reduce the stigma associated with the mental health issues within culturally and linguistically diverse communities, and generally within the Australian community. With a great pride, I say we have a network of over 300 ambassadors across the nation. I would like to thank our ambassadors in the Northern Territory, Edwin, Christina, and Matthews, for their support. I would like to pay a special mention to the Multicultural Council of the Northern Territory, led by Dr. Edwin Lourdes Joseph, staff members, volunteers, who have taken the time to help us not only today, but for the symposium on the 4th and the walk on the 17th. Your assistance is greatly appreciated and acknowledged. I would like to thank our patrons, board directors, scientific advisory committee members, multicultural ambassadors, youth ambassadors, future leaders, volunteers, and well-wishers of the foundation for their contribution towards organizing all these events within this year's National Mental Health Month Awareness Campaign. Last but not least, and I'm sure all our board directors will agree with me, a huge round of applause to our staff member, Priyanka Anandakrishna, for the wonderful work she has put in for these events to come into fruition. I once again thank you all for joining us this evening. With your support, we can achieve many great things regarding the reduction of mental health issues and the stigma that shadows them. Thank you.
Thank you very much, Sheriff Hassan, for your support. I would now like to invite Her Honor, the Honorable Vicky O'Halloran, Administrator of the Northern Territory, to officially launch the event. Her Honor, the Honorable Vicky O'Halloran, was sworn in as the 22nd Administrator of the Northern Territory on 31st October 2017. As Administrator, Her Honor represents the Crown in the right of the Northern Territory. Her Honor performs a similar constitutional role to that of the State Governor and does not participate in the political process. Her Honor was born in Tasmania and moved to Darwin in 1989, where she has resided for the past 30 years. As Administrator of the Northern Territory, Her Honor values the importance of supporting and promoting the Territory and Territorians. She is patron to more than 55 organizations and actively supports the development of emerging Territory leaders. Please join me in warmly welcoming Her Honor, the Honorable Vicky O'Halloran, Administrator of the Northern Territory, to officially launch the event.
The Honourable Naria Kids, Speaker of the Northern Territory Legislative Assembly, Mr Luke Gosling, OAM, Member for Solomon, Mr Mark Turner, Member for Blaine, distinguished guests, and I ask the Council to please pass on my very best wishes to Chairperson Srinivasan for his kind words here this evening and for recognising Territorians. And it's interesting when you hear the intro like that. You don't hear your bio very regularly in this job, but yes, born in Tasmania. And for those of you that are wondering how old I might be, I spent more of my life here in the Northern Territory than Tasmania, and I'm very happy about that. People say to me, well, you know, why are you here in the Northern Territory? Tasmania is beautiful. I said, it just doesn't match our beautiful Northern Territory, and besides that, they have winters that generally go from about January to December. But I also acknowledge the Larrakia people, the traditional owners of the beautiful lands and waters that we gather on this evening, and I pay my utmost respects to the elders past, present and emerging, and I also acknowledge all First Nations people here with us tonight. Craig and I are very pleased to be here to launch National Mental Health Month. The focus of this year's program, as we have heard, is the impact of COVID-19. Now, we could talk about that forever, but tonight I just wanted to mention a little bit about how we work towards this with positivity when it comes to focusing on the post-pandemic recovery, and that's a big topic. So while the health and economic experts are formulating their recovery plans and the mental health clinicians are doing what they do best, I want to focus on what we can do as individuals. There is power in finding the small things that we can all do to make our community a better place, and particularly for those struggling with their mental health. Especially when, and I think we all experience this from time to time, when we're feeling helpless and powerless. For me, I think open communication and kindness goes a long way. We've been very fortunate here in the Territory during this pandemic, but despite our relative freedom, many of us have still felt the weight of facing such an uncertain time. Nobody is immune to feelings of fear and anxiety and helplessness. For our friends, our family, local businesses, our essential workers, those who are unwell, and for the future. And I'm not a stranger to these feelings myself. Our daughter, who grew up here in the Northern Territory, lives in Melbourne, so her safety and happiness during another lockdown is frequently on my mind. This pandemic has given us time to think and feel about what is important to us. It has also given us the opportunity to share how we're feeling, I think possibly a little bit more than ever. And I think this is a very good thing. I recently heard a Territory leader talk openly about his mental health at a really large function. It surprised but pleased me how rare it is to hear someone in a senior leadership position acknowledge their struggles so openly. But the candour of his admissions, without shame, is exactly what we need more of in our communities. Who knows how many people struggling with their own mental health challenges felt comforted by his words, and I'm sure that there were quite a few. It's the relief of hearing somebody saying that I feel that way too that can be underestimated. In that spirit, I was pleased to see that the program for this year's National Mental Health Month has a number of events for people in industries and occupations that we may not normally expect. It reflects our newly evolving definition of what an essential frontline worker is, a term that was often used for our NT police, fire and emergency services, but I think it now covers a whole new cohort. And I've listed here a few of those. Transport workers, truck drivers, hospitality staff, supermarket and retail workers, childcare educators, teachers, factory staff, delivery drivers and cleaners, to name a few. These are people who have been essential since long before the pandemic, but not always acknowledged as such. Now they carry the weight of our community functioning on their shoulders. And at times they face the frustration and angst of a scared and unsettled community. It can't be easy to face that type of unpredictable pressure and behaviour day in, day out. Simply being kind and considerate in our interactions with those who have been thrust onto the front line is a beneficial first step. Individually, we each have the power to be kind, and kindness is known to have positive impacts on the mental health to the giver and also to the receiver. That gesture, I believe, is underestimated in our day-to-day lives and in our communities. The Mental Health Foundation organising team, as we have heard tonight, have done a wonderful job putting together a program that reaches into all parts of our population. This week at Government House, we've hosted dinners and functions, and primarily for volunteers in our community. People going about their business. What do they say? You want something done, you ask a busy person, and that applies here this evening. It's a wonderful privilege to be your administrator, and a wonderful privilege to be part of recognising Territorians who often don't get an invite to Government House for other things. So our reaching out to acknowledge those people, and many of you here in the room tonight, is an absolute privilege. Giving people the chance to share their struggles with others who know what they're going through is the ultimate act of kindness. So let us all take time out each day to be kind, to be friendly, generous and considerate. And on that note, it is my great pleasure to officially launch National Mental Health Month here in our beautiful Northern Territory. Thank you.
Thank you, the Honourable Vicky O'Halloran, Administrator of the Northern Territory, for your kind support. Please accept this engraved plaque as our gesture of appreciation.
Wow, thank you so very much. Again, it's a symbolic demonstration of your generosity, and I think the last time I received a trophy was for most improved in hockey in Corribbean.
Now, I would like to invite Honourable Ngari Akit, the Speaker of the NT Legislative Assembly, for a formal address. Ngari Akit is a member for Karama and Speaker of the NT Legislative Assembly. An Aboriginal and Torres Strait Islander woman of Chinese descent, she was born in Catherine, NT, and has spent most of her time residing in the northern suburbs of Darwin. She followed her late father, John Jack Akit, into territory politics and became the first Aboriginal female Speaker of an Australian Parliament following her re-election in August 2020. Ngari's focus on preventing suicide and the impact that loss of life has had on those who are left behind by investing in initiatives that encourage individual and community empowerment and grassroots-led projects. Through her lived experiences of suicide, mental health, and leadership, Ngari seeks ways to eliminate barriers that prevent Territorians from accessing quality services that enable them to live independently and contribute to their family and community. Ngari is also focused on supporting the mental health and well-being of elected members during their term, and is looking at ways in which members can be better supported throughout their departure from the NT Parliament. Please welcome Honourable Ngari Akil.
Thank you very much. Absolute honour to be here with you all to celebrate the launch of National Mental Health Month, a very, very important occasion. I'll start by acknowledging the land that we gather on tonight. It's absolutely beautiful. It was beautiful earlier when the sun was out, the Larrakia people, and thank them for sharing this wonderful piece of the world with us. I acknowledge that they work extremely hard. They're working really, really hard now to look after country, to make sure they pass their culture on to the next generation. And I really love that they're going above and beyond to try and restore old Larrakia language. So watch that space. Thank you to Your Honour for the wonderful welcome. Thank you very much. It's great to see you here, Craig. Member for Blaine, Luke Gosling, Federal Member for Solomon. Ladies and gentlemen, we've just heard a very, very lovely, heartwarming and very true speech from Her Honour. We all know how important it is to look after our own mental health, especially when we've got this global pandemic still going. There's a couple of things I just wanted to share with you all tonight. So I was telling Professor Dan earlier, so I did come into politics because I wanted to fly the flag up here in this place and make a change from the top down to help prevent suicide, loss of life, and to also support people to have a better quality of life through accessing quality mental health services. There's a couple of things that I've noticed in my 5 years as a politician in the Northern Territory Legislative Assembly. For those of you who live or know somebody who lives in the electorate of Karama, we have a high level of vulnerability out there. You know, we've got 1 in 5 public houses all the way through. So we've got thousands and thousands of people in need who are always looking for a way to live a better life. You'll see us in the news all the time for all the wrong reasons. But what the media fails to realise is we have so many good stories there as well. What you see is a very, very, very small snippet of people who are making bad choices. What I spend a lot of time doing with my background is trying to understand what led to that behaviour. And I know that a lot of you do as well, because that's where that compassion and that resilience comes from. That's why we need to make sure that we do whatever we can to not judge people for what they're doing, but to try and understand why they're doing it, and better still, to try and make the changes and the reach out of support to support them to make better choices, because there are a lot of our kids out there who are watching exactly what's going on and they're learning that behaviour as well. So as local member, I guess the global pandemic has had a real impact on my little electorate and my community members. And I love the fact that we go above and beyond, we touch base with vulnerable people every time we go into a lockdown. Just a simple phone call. How are you going today? No, I don't need you to vote for me. That's in 3 years. You know, have you got enough toilet paper? Do you have enough food? Do you have any face masks? Have you got people's numbers? All of that stuff. And it really, really goes over well. And it's not there for a vote. It's not there to be political. It's there to be a human being. Because there are a lot of people out there, especially when it comes to lockdown, who are very scared. They feel like they're very isolated. So just to reach out can really help. Like what was read out in my, my biography, as I brought my knowledge and my background into my role as speaker, and I also am flying the flag for suicide prevention and mental health there. I know, Mark Turner knows, Luke Gosling knows exactly what a lot of people think of politicians, and I'm not going to repeat some of the things that are spread around social media, but we're human beings. You know, and like Arona said, we actually have our own mental health to look after, and we in positions of leadership, feel like we're not able to, I guess, put it out to the world that, you know what, we're actually able to have really bad days and really bad times as well. Nobody likes to read the garbage that's on social media. I spend a lot of time away from it. I'm not interested because it can really pull you down, it can really impact you, and it makes it really hard to get up every morning and to keep fighting for what is right, to keep picking up that phone and to keep supporting people because they deserve it. And so as the speaker, I'm always very conscious of the stresses and the pressures that my 24 other Northern Territory parliamentary colleagues go through. I have a very clear idea of what they're going through in their electorates. I understand from my speaker's point of view what they're going through as well. And so I'm always going to look at ways where I can support them, because at the end of the day, that's my job. I'm here to support the 24 other parliamentarians so that they can support every single Territorian that they're elected to represent. And so one of the biggest projects that I'm delving into at the moment is trying to make sure there's a softer landing for politicians on the way out of Parliament. As a teenager, I got to watch my dad in politics for 10 years in this Parliament. I got to see how when he walked out of Parliament, the door closed behind, and that was it. There wasn't even like a thank you for your service, it was just, see ya. I want to make sure that we do things differently, and so that's what I'm going to be doing in my role as Speaker. I've recently had an opportunity to maintain contact with the former member for Daly, just to check in. Hi Ian, how are you at Tenari? How's things going? I know you've only been out for a couple of weeks, but it's been a very busy time. You've seen a by-election. If you don't mind, I'd love to maintain regular contact, just to touch base, just to see how you're going. A lot of parliaments around the country do it a lot better than we are, and so I don't have to reinvent the wheel. I just contact my fellow speakers around the country, find out what they're doing, and then try and adapt that to make it work here. And I think that's what I'll leave with you all, is we don't have to reinvent the wheel for what we're doing. We know our communities, you guys are very well connected, and huge supporters of the way forward for mental health. So keep up the good work, keep doing what you're doing, and I really hope I get to see you out and about during Mental Health Month. Thank you.
Thank you very much, Honourable Nari Akif, for your kind support. Please accept this engraved plaque as a gesture of appreciation.
Thank you.
Before we proceed to the program, we would also like to acknowledge the presence of Honourable Mark Monaghan, MLA, Member for Fong Lim. Thank you so much for coming tonight, sir. I would now like to invite Mr. Luke Gosling, MP, Federal Member of Solomon, to provide a formal address. Luke Gosling is the Deputy Chair of the House of Representatives Standing Committee on Infrastructure, Transport and Cities, and is a retired Australian Army officer. Mr. Gosling has been a member of the ALP since 2004 and has been Federal Member for Solomon since the 2016 federal election. After leaving the Army, Luke worked overseas in countries such as Afghanistan, Cambodia, Albania, and Timor-Leste. He co-founded a non-for-profit NGO called Life, Love and Health, or LLNH, as an Australian volunteer charity for Timor-Leste. LLMH fundraised and built schools, brought running water to remote villages, and delivered maternal health care support with local NGOs. For this work, Luke was awarded the Order of Australia Medal in 2006, and for his relief work during the 2006 humanitarian crisis and the Office of the President, he was awarded the Timor-Leste Medal of Merit in 2009. Luke established the federally funded Remote Area Health Corps in the NT to prepare and provide GPs, nurses, dental and allied health professionals to remote Northern Territory health centers. Luke promotes trauma-informed care and works to achieve improved health and well-being in our community, including through volunteering with Vinnie's and several ex-service organizations. Please welcome Mr. Luke Gosling.
Thanks very much, everyone, and good evening. It's a real privilege to be invited along here to address you all. I want to acknowledge, of course, the Larrakia and any other First Nations people that are here today. I think that our First Nations have an incredibly important role to play in good mental health. There's a lot that we can learn from their learnings. I think here in the Territory we should have a First Nations university, and I think that university should draw from the knowledge gained over millennia, not by just First Nations of our continent, but of others, a place of sharing and a place of deep knowledge that will be able to inform the rest of us about care of ourselves, care of our families, care of country. So let's see. I would like to see that. To the Administrator, Craig, Nari, Mark, someone who is able to move between different worlds. Mark, another Mark Turner from Palmerston. I was in Palmerston this morning on the side of the road doing what I call a mobile office, and I had several people come and stop, and we had some great conversations, and it was great to get that feedback from the community about how they're going and where the stresses are for them in their workplace, anxiety about new rules and new ways of working, and the importance of really being there, as the speaker said, to help people through those challenges. It's incredibly important, and I want to acknowledge all of you in this room, because the reason that you're here is because you are invested in better mental health for our community and for our country. So I want to acknowledge the foundation and its great work. I met with a group of very enthusiastic newcomers in the mental health field to Darwin this week in my office. Healthy Mind Australia. So they're social workers, and they're going to be working very closely with other providers here to assist people, whether they're in the NDIS or not, through the challenges that they face. So, yeah, it's an exciting time, because there are some resources being provided by the federal government. There are obviously resources provided by our NT government, and that's important, because with funds we can provide great services that are going to help our fellow Territorians, fellow Australians. So I always encourage the federal government to do more in this space, and our own colleagues keen to do more in this space. I work with several ex-service organisations, and recently we've heard that the rates of suicide in our former serving people are increasing and are much higher than we had thought. Many of us knew that it was a much worse situation that was being depicted. But you all know in your communities the hidden epidemics of unwellness. I was told this week that it's psychosocial disabilities is the way I should be referring to mental ill health. A straw poll that I conducted this afternoon said that they were happier with the idea of mental health in general as being a positive thing. Like, that's what we want, is good mental health. I understand the need to describe things in terms of psychosocial and disability, but I'm sure others in this field might be able to school me a bit on the importance of different terms and different techniques of assisting people through a journey to good mental health. And as the administrator is led by example in relaying a story about someone else who had volunteered their own mental ill health, I've got no dramas at all in saying that in times of my life I have struggled. I have lived in situations where there was continuous stresses that cumulatively just loaded down on me. I had a relationship breakup once where I thought my heart was physically damaged. I was sad for so long of being in need of help. And that help hasn't always come from professionals, of course. It's come from my friends and family. It's family so important in getting around you and providing that deep love and support that is so important for you to feel well and to take some of that load off. And just getting back to where I started as I wrap up, I was healed by a First Nations healer from the desert country down at the waterfront a couple of years ago. And because of what the speaker relayed in terms of the stresses of the job that we do, I felt all this heaviness. And I suppose it's a bit of an ad for First Nations knowledges and healing, but Uncle John was his name. He's in RDH at the moment. But he applied words and his hands to my head, and I swear by the time he had finished with me, I felt like 20 kilograms lighter. Like, I just felt like I was floating. He'd taken so much stress or anxiety or that weight off me, and I was so thankful for that. And it was an incredibly powerful thing. So I just want to congratulate all of you, the foundation, but all of you for the work that you do in your communities, and just promote the need for trauma-informed care all the way through, whatever we do, in government, in the not-for-profit sector, wherever it is. And it's important that we lead by example. And just this week I had the Team Health outreach team come to my office, and we had a half-a-day session just with my staff, talking through the stresses that they have in their job, the people that come to our office in different states of wellness, needing support. And I'm really glad that I did that, because it gave my staff some of the tools, some of the really important tools to be able to reach out and get the support that they need when they need it. So I'm really thankful to my staff. I'm thankful to all of you. I'm thankful to the leaders in our community for the role that they play in supporting great organisations like this foundation. Thanks very much.
Thank you, Mr. Luke Gosling, for being here with us tonight and for your kind support. Please accept this engraved plaque as a gesture of our appreciation. Now I would like to invite Professor Daniel Bressington, Professor of Mental Health, Charles Darwin University, for a keynote address. Professor Daniel Bressington is Professor in Mental Health at the College of Nursing and Midwifery at the Charles Darwin University. Dan is also an adjunct professor at the Hong Kong Polytechnic University and visiting professor at La Trobe University. He previously worked at the Institute of Psychiatry, King's College in London, and the Bethlehem Royal and Wadsley Hospitals in London, UK. Dan is a UK registered mental health nurse with over 25 years experience. He has around 100 research publications in international peer-reviewed journals and is an associate editor for Nursing Open in Wiley and Frontiers Public Mental Health, specialty sections of Frontiers in Psychiatry. He is also an editorial board member for the Journal of Psychiatry and Mental Health, Nursing, and BMC Psychiatry. His research interests include multi-morbidity in people diagnosed with a severe mental illness, developing, testing, psychosocial interventions to improve mental health, and mental health literacy stigma. Please welcome Professor Daniel Bressington.
I'm just going to ask you to give me a little bit of room there, if you don't mind, please. Thanks. I've upset everything because I've brought a different way of presenting, so this is not the old PowerPoint that we usually do, so I didn't want to risk asking someone to do it. There we go. Okay, so Honourable Administrator, Honourable Speaker, Ministers, distinguished guests, thank you so much for inviting me here today. You can hear by my accent that I'm British, and thanks for the great bio. And it's a little bit difficult to follow your poignant speech, actually, so I'm going to give it a go. Before I start, and you can see what I mean here about a bit of clumsiness on here. Okay, before I start, I want to acknowledge the traditional custodians of the land where we're meeting, the Larrakia people, and pay my respect to the elders, past, present, and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people. What I'm going to do is to talk about mental health and COVID in line with the recovery focus of this evening and also of the month. So I'm going to kind of cover three quick questions really. So what's the impact? So what? So what does that mean for us? And then now what? What are we going to do in the future? There are a lot of studies done on COVID, of course. People are now making their academic careers on this. So what I've done, we've got a limited time, I've just chosen a couple of the most important ones, I think, and then kind of think about how do we move on. Okay, so let's try what first, if it's going to work. Yeah. Right, so, well, what is the impact of COVID on people's mental health in Australia on a national level? There's been a lot of studies done, and it depends on when they were done and where they were done as to what the results were, actually. But the first one I just want to kind of draw your attention to was right at the beginning of the pandemic. And this study reported that up to, or just over a third of people were experiencing moderately severe to severe distress associated with their mental health. And quite understandably, people were concerned about their loved ones' health, their own health, and their economic situation. And this was one of the first studies to show, unfortunately, that younger people and women, particularly, as in younger women, were suffering the most. So that was one of the first indications. Another study done more recently this year also revealed similar results. So about 1 in 5 Australians in this study were experiencing moderately high or very high levels of psychological distress, which is about twice what we would expect normally. And again, unfortunately, younger people seem to be the ones most at risk, and probably not surprisingly, people in lockdown and higher rates of infection also had higher levels of distress. So this is worrying about young people for me. So I wanted to look at, well, what about children? Because most of these studies were 18 and over. So this first one here looked at parents and their experiences. This was, again, right at the beginning of the pandemic. And what you can see here, unfortunately, that people were very stressed, alcohol consumption was going up, there was more conflict within the family, and a lack of warmth and kind of belongingness. And for young children, this is a worry for me. And then also, there was a survey done of children's mental health. And this found that almost a third of children in this study that the parents reported had emotional problems, conduct problems, anxiety, depression, etc. So the impact is extending beyond just younger kind of teenagers and adolescents. This is young children as well. Okay, so what does this mean? What does this mean particularly first for mental health services? Well, there's been consistent reports of rapid increases in calls to helplines, particularly Kids Line is an example here, and most of those relate to mental health. So on one hand, that's really worrying, but on the other hand, that's actually quite good that children and young people are finding it acceptable to seek help, which is a good sign perhaps that mental health, and one of the bonuses maybe of COVID is that we're talking more about mental health and that we're willing to share those issues. If you look at the Medicare data, interestingly, when there's a lockdown, the demand for services tends to drop off a bit, but as soon as those restrictions are lifted, people tend to present to their GP or to psychiatrists. So given that we're expecting a relaxation of the restrictions nationwide and perhaps internationally, we should be expecting an increase in need for services, and we need to do something about that. Okay, so what else does it mean in terms of a wider picture? Thankfully, so far, the evidence shows there's not an increase in the number of deaths by suicide during COVID, but we have to remember that there is a delay in the reporting of deaths by suicide. So this remains to be seen. As I mentioned before, we can expect there's an increase in demand for services following a relaxation of restrictions. And some studies that follow groups of people through over time show that the levels of distress drop off after restrictions are lifted and after the rates go down. But we do need to be mindful of the fact that there's a lot of dropout in those studies. So the term I've used there is survivorship bias, and basically what this means is that the people that stay in studies tend to be the ones that have got better mental well-being, and the ones that are more unwell drop out. So we need to be aware, not, hopefully that's a positive sign, but we need to take it with a pinch of salt. This point is really important. We really don't know what the long-term effects of COVID on mental health will be. The direct effects and also the indirect effects. So we need to be very alert to that. And what we do know, as was mentioned before, that prolonged stress is very difficult to recover from. So it takes some time. So, we're really going to need a concerted, supported effort to support people in the next years to come. This is not just an immediate need. And again, for me, as a practitioner, as a mental health nurse, I'm very worried about the mental health of young people as a result of COVID. This is where I think is where we really need to focus. If we think about it, social isolation, prolonged stress, problems with family dynamics, all these kind of things are adverse childhood experiences. And we know that people that have a lot of adverse childhood experiences experience problems with their physical health and their mental health for some time to come. We really need a concerted investment and focus on helping people recover. Okay, so now what then? So what do we do next? Well, evidence, again, which of course I'm going to talk about because I'm a professor and a researcher, but this was a really interesting study done last year, and it looked at people's preferences for policy to promote recovery from COVID. I won't pick up on them all, but the mental health related ones particularly were around people wanted more community-based mental health support services, not just clinical services. So these are things like men's sheds, social gatherings, things that are run by the Mental Health Foundation. This kind of stuff is what people want. It's less stigmatising to go to these things than present yourself to a psychiatrist or to a nurse or whatever. At least, well, around about a third of people wanted more face-to-face counselling, and up here in the NT that's quite difficult to get. There's a real lack of psychologists, and they wanted simply for GPs to ask them about their mental health when you go for an appointment, just a quick check. And maybe there would be some room there for training for employers to manage people's transitions back into work if they've been working at home. So I suppose relevant for us here in the NT, and it was alluded to earlier, we have been lucky, but we've worked hard up here to manage COVID, and we've been spared very long lockdowns. And my feeling, and certainly as we were talking earlier, we feel locked in, right? Because we can't go and see our families across Australia or internationally. We can't do the things we normally do. We're all worried. People have still got economic issues to deal with as a result of COVID up here. So really we need to think about our mental health and our recovery too, and find out what exactly people want and what they need, and that needs to be from the ground up. And of course, it was already mentioned, maybe we want some more federal funding to promote better access to services. Personally, I think there should be free and easy access to counselling. It doesn't need to be in a clinical setting. Younger people's mental health services need to be developed. We have a problem up here with the mental health workforce, particularly nurses. So we really need to invest and focus on trying to attract, retain and train staff. And we do need to do some more work on suicide and self-harm programs, probably community-based or better. And finally, perhaps some mental health first aid training for individuals, organisations and schools so that we can help each other and we can identify when things are getting very difficult. So let me sum up this brief presentation. I don't want to be all negative because that's not me. People's resilience is challenged, no doubt, but most of us bounce back. Okay, we do have that psychological resilience and resolve to be able to bounce back, so that's good. It's also good that people are seeking help. That's fantastic, and as I say, that might be the silver lining of the COVID cloud in my mind, that people are willing to talk. Unfortunately, we can't get away from the fact that younger people are suffering, and I would call it the COVID mental health legacy for young people is a worry for me, and it should be for all of us. We do urgently need additional support and funding in this area, not just for clinical services, but for community-based services. And lastly, I think from a policy perspective, we need clarity and hope in order to maintain resilience and work through this, as a group together. And I'm really pleased to be here with the Mental Health Foundation that are doing such a fantastic job to hold people together during this really difficult time. So, thank you. That's what I've got to say. They're the references to support what I said, because being an academic, you have to do that. That's great. Thanks again.
Thank you very much, Professor Daniel Bressington, for your kind support and joining us tonight. Please accept this engraved plaque as a gesture of our appreciation. So now I think everyone's been sitting here for quite a while, listening to all the wonderful sharing and things you have about mental health. So the food service will be open again for the next few minutes. Everyone, please feel free to help yourself to some food and beverages as when you need. For that, I would now like to welcome Kevin McCoy, the CEO of Australian Unity, to say a few words as the MHFA's major sponsor for National Mental Health Month 2021. Kevin McCoy was appointed CEO of Australian Unity's Independent and Assisted Living Division in July 2017 and has the great fortune to represent almost 60,000 customers across the company's Indigenous, aged care, disability, and health care services. Kevin spends as much time as possible on the road visiting Australian Unity's customers and its 6,000 employees. He believes it is in his customers' homes, retirement communities, aged care homes, and the remote communities of the company's Indigenous customers that he gets to truly understand how to make a difference in the lives of those people who trust Australian Unity with their well-being. Through these travels, he has met some amazing people, heard some confronting stories, seen the loneliness, and laughed a lot. This experience has given Kevin an incredible insight into customers and older, vulnerable Australians, while also developing a respect, appreciation, and admiration for the healthcare workforce. In 2019, Kevin was a founding member of the Aged Care Workforce Industry Council and was acting chair until July 2021. He is also chair of the Ramsay Connect, a joint venture with Ramsay Healthcare and a national provider of home and community-based healthcare and support. Can you please play the recorded message? Thank you.
Hi, my name is Kim Ellis-Kavidi and I'm a registered pharmacist and the State Sales Manager for Chemosone for WA, SA and the NT. Chemosone is an Australian-owned, trusted branded community pharmacy for over 25 years. We are proud to be partnering with Mental Health Foundation to promote better mental health in local communities around Australia, particularly with our dedicated customers, our pharmacists, who are integral in providing support to their local communities every single day. This year's theme of post-pandemic recovery, challenges and resilience will no doubt resonate with individuals, families and work teams, as it will personally and collectively be impacted one way or another over the last 18 months. This extends to our customers on the front line, who have constantly been under pressure to continue to serve their local communities during the pandemic.
Sorry, we have experiencing some technical difficulties. So I guess you should now proceed to the video. I would like to welcome Carmela Scafidi, the Western Australia and South Australia State Manager of Chemist Zone, to say a few words as the MHFA's major sponsor for the National Mental Health Month 2021. Kindly play the video. Thank you.
Hi, my name is Kim Ellis-Kavidi and I'm a registered pharmacist and the State Sales Manager for Chemosone for WA, SA and the NT. Chemosone is an Australian-owned, trusted branded community pharmacy for over 25 years. We are proud to be partnering with Mental Health Foundation to promote better mental health in local communities around Australia, particularly with our dedicated customers, our pharmacists, who are integral in providing support to their local communities every single day. This year's theme of post-pandemic recovery, challenges and work teams, as it will personally and collectively be impacted one way or another over the last 18 months. This extends to our customers on the front line, who have constantly been under pressure to continue to serve their local communities during the pandemic, with issues including stockpiling, medication shortages, in addition to continuously providing health advice and service to customers. If there is anything this pandemic has shown, it is the resilience of the community. However, what is crucial today is the promotion of non-judgmental discussion around the importance of mental health, and the mission of this foundation to support these discussions and champion positive mental health is a matter Chemistone supports wholeheartedly. We thank Mental Health Foundation Australia for recognising the various vulnerable communities in Australia and dedicating events to professionals, including the discussion of mental health for pharmacists, acknowledging the vital role pharmacists play in our community's response to mental health issues, and recognising the increasing vulnerability they face due to their profession. Lastly, through the annual Chemistone Help Us Help Our Local Community campaign, participating pharmacists nationally will come together to support this foundation with us and with their local community with the sale of Chemistone until December. Thank you.
Thank you, Carmela, and thank you, Chemistone, for your continued support. Once again, we would like to thank our dignitaries who have been here tonight. Her Honor, the Honourable Vicky O'Halloran and Mr. Craig O'Halloran, thank you for being here tonight. Honourable Ngari Hakit, Mr. Luke Gosling, Mr. Mark Turner, Professor Daniel Bressington, and Honourable Mark. Thank you so much, everyone, for being here. We would also like to acknowledge our valuable sponsors who made this possible. The Chemistone.
Over 400.
Chemistone, Australian Unity, and all patrons, directors, staff, volunteers, ambassadors, representatives from government department, community leaders, and attendees who joined us here tonight. On behalf of Mental Health Foundation Australia, a big round of applause and thank you to the Multicultural Council of the Northern Territory, headed by Dr. Edwin Lourdes Joseph, and all wonderful volunteers who have taken the time to help us not only today, but for the symposium on the 4th and the walk on the 17th of October. In your assistance, it is greatly appreciated, and we are grateful for your passion. Thank you all very much for being here tonight. We encourage you to attend our Multicultural and Refugee Mental Health Symposium on the 4th of October at the Darwin Convention Center, and our Walk for Mental Health on the 17th of October at the George Brown Botanical Gardens. Please feel free to stay back and enjoy some of the refreshments that are still available. It has been an honor and pleasure to be your MC for tonight. I am Christina Magboas, one of your multicultural ambassadors and deputy leader for MHFA Northern Territory. Thank you and good evening.
Thank you.